Hi, how are you? This is Dr. Damaris Maria Grossman, Integrative Family Nurse Practitioner. And I am today on this Mindfully Integrative podcast. We're talking and mindful chat with Dr. Vani Gandhi. She is an infectious disease doctor at Mount Sinai Hospital in New York. And her and I had met wonderfully a few years back at an integrative health symposium. I was doing some research work and she was doing plenty of I think research work, and we met at one of the talks. And from then on, we kind of connected through social media and such. And we knew that we kind of had that integrative health mindset. So she will tell you a little bit more about herself. And Dr. Vani, thank you so much for joining in on the show. And I hope, how are you today?
Yes, I'm good. Thank you very much. And thank you for inviting me, Dr. Damaris. And I still remember that moment when we first met and all those few moments that we were interacting at the symposium. And after that, of course, the rest is all history, how we stayed in touch. And thank you for reaching out to me for being a guest on this talk.
Oh,
Podcast.
absolutely, Dr. Vani. I mean, one, I know that you very much so deeply believe in integrative health, and then also, in your work and such. So um, you tell the listeners and those watching a little bit more about yourself and how you got into integrative health and kind of where you are now.
Yes, absolutely. So my story actually probably goes way back in India when I first got exposed to yoga when I was very young, and my parents took me and my brother to yoga classes. Maybe initially I might have gone reluctantly, but then I probably enjoyed. I don't remember all the details, but I do remember some things.
Yeah.
Going to an ashram and going to a yoga institute and doing yoga with my mother, and my brother was doing yoga with my father. So that's where I think the base is. But I think it probably goes back even further back, where I saw my grandfather, who was a doctor, who was practicing. And in those times, it's a general practice, and most of the physicians, doctors used to practice out of their home in the ground level, and then the home is the rest of the building. So I saw him sitting and talking to people and the patients, mixing his medications in the back. And I would stand and watch him, very young, just, very naive about whatever this is, but just
Mhm.
watching. So that's where my probable background comes from. And then, went into medicine, and I came here to the US. And in the last several years that I have been doing infectious disease, I got more and more into talking about nutrition to my patients, to help them to address their lifestyle, talking to them about exercise. And then one of our previous managers of at that time called the complementary medicine program, left the program. And so the director of our institute approached me. She called me over to her office, and I said, "Oh, am I in trouble?" So that's
Oh
what I'm
no.
thinking. And then she said, I want to offer you this position. And she said, I've been watching your growth over the years, and you'd be the right person for this position. So she put me in charge of the complementary medicine program. I said, okay, but I need to discuss it at home and look into it a little bit more in detail. And I'll get back to you in a week. So I did my own research, and I found the integrative medicine fellowship out of at the University of Arizona. And I went back to her and I told her, okay, I'll take this position as long as you approve and fund at least part of my training. And she said, okay, I'll do
Oh,
that.
wonderful. Yeah,
That's how it
I
started.
did part of my training also over and with my nurse, like when I was getting my DNP doctor for nursing, and I did part of mine with them with Arizona
Yeah,
State too.
so
So
that's
amazing.
that's how it started. And she said, okay, you start work now, but I
Oh
will
my
support
gosh.
your
Start
training.
work. Make it happen.
I said, okay, I'm going to just do some basic guidance to patients on nutrition. I was already doing a lot of reading anyway, so
Mhm.
that's why I got chosen, I'm sure. But then I had to get more serious, got some books, and looked up the literature even more. And yeah, that's how it started. And then I got more and more into it. And, after I did the training, it very much blossomed into a whole different way of thinking for myself, for my colleagues. I made sure that training for the residents at our hospital, and then the staff at our department was also part of my work. And that was agreed upon, that that would also be part of my work. I wanted that education would be a big part of my work.
And you integrate that in your work as well as in every aspect. I mean, you probably do it in every aspect of what you do anyway.
Right. Yeah, so that's how it started, and it's a whole different story now, but that's where the beginnings are.
That's where the beginnings are. Oh no. So how, like, in reference to, like, did you go through a lot of struggles? I mean, I know this past year, COVID, of course, been a big struggle that has helped you even grow more with, not even just integrative, but that has kind of been inspiring through your medical and, career.
Yeah, so there have been a lot of struggles over the years, and going to medical school itself is a struggle. Doing my residency and infectious disease fellowship is a struggle. It's tough. I
That's
mean, we know it's
challenging.
tough, but we get a lot out of it. We learn a lot in terms of that knowledge and the experience, but also as a person, we learn how to be with people and be able to manage everything about the person. And in the last year, there's been tons of other struggles, seeing my patients suffer from the consequences of COVID.
Mhm.
Thankfully, none of my close family were sick, but some extended family, friends, and other people did get sick. And, I was the go to person for some months from my family side, my own colleagues from my medical school, who are all either assistant professor or associate professor of medicine, either in the
Mhm.
US or other parts. Suddenly I became the go to person, even though they are very advanced in their training and experience. But because I'm an infectious disease doctor, and also
Especially now.
probably because of integrative medicine too, they were asking me questions. Is there something else that could be done? And most of the time, I could be able to, talk to them and guide them and, help them. Yeah, and then in the hospital, I saw a lot of challenging situations with patients, other
Yeah.
workers, other healthcare workers, nurses, other professionals going through so much, in their day to day and in their life, in their
Yeah.
personal life, family life has really been affected really severely for some people I know.
Yeah, it
Yes.
is such a struggle. I mean, I don't go into great detail now, but I had my dad pass from COVID and dementia last year. And I've had a
Oh,
number of
I'm so
people in the
sorry.
no, it's okay. No, I'm saying, and it's not just my story, but you have been faced with so many people's story this past year, and you've had to find ways people want to connect with you, probably ask you questions upon questions about the infection, the disease itself. And
Mhm.
then is there other ways to help? And do people want things to, like, where people asking you questions on, like, what can I take, what can I do?
Mhm, mhm, mhm. Yeah, they all wanted to know, can I take XYZ supplement? Will this help me? Will that help me? I would say, I don't know. This is new.
This
Most of
is
the time, I would say, I don't know. There
yeah,
were a
so
lot of
like
I don't knows.
yeah, there's so much research. Like, I just even read another research article about XYZ on the milligrams of, I don't think it was Coursera or curcumin, turmeric, and I was just looking. I'm like, oh, is this one right? And so and someone had asked me that. I'm like, oh, I have to look back, and I don't think we don't have enough research on it yet.
Yes.
We're
Mhm.
still working in that direction. Um, was there? I mean, and a very fun question: is there
Mhm.
something that people don't know about you that you want to share?
Oh, yes. That is a very interesting one. There are a lot of things like that, but one was coming to my mind within the last few days. I was saying to my daughter, she knows it, of course, but most people don't know I met Indira Gandhi.
Really? Oh my gosh! Were you
Yes.
practicing? Oh
No,
my
no,
gosh!
no. I was very small. Like
Oh, you're very small.
uh,
Oh my
I
gosh!
was probably in my teens, and
That's
my
amazing.
my father and mother both were very into community service. So they were
What were
leaders in their local organization in Mumbai. And so, as part of that, they were touring places, going to conferences and meetings and so on. So, one of the time it was, we were going to the north. And so they said, okay, we should go and meet Indira Gandhi.
Oh my
Of course,
gosh,
I'm
the
not going to
peaceful
say anything,
warrior
I'm
at
too
heart.
small.
And you're
Yes.
Gandhi too, your last name, you know?
Yes. So I have a picture with her, and it's just so fascinating to see that now, after all these years. At that time, it's like,
Wow.
okay, I just met somebody who was the prime minister, but
I
okay.
know, but that's so amazing. Like,
Yes.
did you, wow. And then now you kind of take back, it's like, that is pretty cool. Yeah, that's like that's definitely, you got to put that in the books for. And have you had, like, I mean, well, let's go to like inspiring. Were there people through your career, even in integrative health, and that have kind of helped you along the way, or even just an inspiring quote, maybe even a book?
Yeah, so there have been many points where I can say I've been inspired. My grandfather, as I was saying, who was a practicing doctor, he was a physician who was titled, I think he received the title captain because he did some work through the World War II. And so, I would see that captain on the board at the door, and it's, oh, this is great. Not knowing exactly what it meant, but this is something good.
Yeah.
So yeah, so then I would see his practice. So that was one of the inspiring
So he was like a military
moments.
doctor?
You could say it that way, but not really, because he probably went one time to
Okay.
do some
Okay.
work, but he received the title. But even other than that, he was the chairperson of the president of the Tamil Nadu, which is the state where he was practicing,
Mhm.
Tamil Nadu Medical Association. So he was, leader in many ways within the state and country. Then later on, my mom is a major inspiring person, woman.
Oh.
She worked all her life, and um, I would see her go to work every day, you know, pack us up, the kids, me and my brother, and then go to work. Sometimes I used to go to hang out in her office, and I would see she would be administrative level and have several people under her,
Oh wow.
and direct that office. And yeah, so she's still in India. She's still my major inspiration as a woman and a leader.
In the
So
leader. Oh,
she
well,
still
you're a leader
drive a
in your field.
car and go to work. And there was a time that she had brought in life insurance to the police officers in Mumbai.
Mhm.
And so a lot of the police officers in the city used to know her. So when she would drive, they would salute her. So it was amazing to see
Oh
all that.
wow.
And of course, it was tough life being a working woman and all of that. And, there are some negatives to that too, because she's not home all the time. But, there were a lot of positives there. So, yeah, so during my childhood, it's my grandfather and my mother. And then later on, it's my daughter now in my personal life. I think my daughter
Oh,
is a major inspiration.
that's
I taught her
amazing.
a lot over the years, and now sometimes she's teaching back to me things that I've told her, and she said, "You told me this before, and you need to do this."
That's so great. Oh my gosh. Like, it's kind of like that full circle. I guess now that I'm a new mom, I
Hmm.
go, I hope that I, ingrain and hope, more happiness and love. And I guess that's kind of where we always think about like that, just, bringing out love as much as we can and positive thinking to these little ones and
Yeah, and then
you
in terms
inspire
of
her.
right, right,
Inspires you, you
absolutely,
inspire
she's
her.
she's constantly telling me something which I might have told her before. Yeah, so
Oh.
and then in professional life, there have been many leaders. I remember over the years, one of the main ones who stands out here in U.S. is the first professor who I met, Dr. Janet Shapiro. She's a intensive care unit doctor, still practicing here.
Mhm.
I met her on the first day when I came in to work as an intern, and she
Oh.
taught me so much over the years. I worked a number of times directly with her, and now I see her, off and on.
Mhm.
Or she might send me an email and say, "Oh, I'm so happy that you're doing so well," or, something nice. She'll
Oh.
say something positive. So that's her. And then in the integrative medicine field, Dr. Andrew Weil is a major inspiration. And Dr. Tirona Lowdog is a major inspiration. She's
Who is
our
that? I don't think I knew that. Who is that?
Dr. Lowdog. Yes, she's a herbalist, MD, and
Good.
she was a major faculty at the University of Arizona. Now she has
Okay.
left that position,
Okay.
but she was uh, very major
Very major
in that
in the I
faculty at the
probably have read
University
her
of
work and I
Arizona.
just probably didn't
You
realize
have
it.
definitely, she has multiple books in publication. I could probably send you some of the
Oh, sure.
covers which I have. So she's been one of the major inspiring women and leaders and doctors in my work in integrative medicine. And I have many colleagues also constantly inspire me, but these are the people who really stand out.
Oh, that's amazing. I mean, through the time that you've been working and now that you kind of are, especially this past year, having to implement, what are there, is there like something that you can maybe tell the listeners or those watching a little mindful thought or way that you kind of helped or implemented with, not necessarily patients, but in your life to kind of get you through, especially like during those tough times?
Yeah, I think there are many things to consider when we discuss this sort of subject.
Yeah.
One of the things that comes to my mind is, usually don't tell a patient or somebody just go ahead, go do this.
Hmm.
I model it most of the time. I'll say, okay, this is what I do. I walk every day, or, I eat fruits every day, or something like that. So there's one quote by Mahatma Gandhi: "You must be the change you wish to see in the world." So that's something which I've been always practicing, whether it's in the home or amongst my colleagues or friends or in the professional life. If we don't model or practice the healthy behaviors, we cannot expect our patients to, do that. It's very tough
No, it's
to
totally tough.
to practice, and it's very tough to live a healthy lifestyle, and it takes a lot of effort. We know that, and it's even harder for our patients. So,
Yeah.
and it's gotten even harder this past year. And I sometimes will say, okay, this is what you have to do. But most of the time, it's a very soft approach. And I'll say, okay, what do you think you can do? I just put it over to the patient and
Hmm.
ask them, what do you think you can do going forward? Like, for example, if someone's gained weight, I'll
Hmm.
say, what do you think you can do? What do you want to do, in the next few months before you come back to see me? And then, is it only regarding weight? No, it's about everything else.
Yeah.
All of our lives have been scattered in the last year. Things have changed. We don't get together the same way. People are more isolated. So it's very different. So we cannot be harsh on ourselves, and we cannot be harsh on
On
anybody
them.
else around us. Yeah.
No, I love that fact. I appreciate the fact of you saying like you practice what you preach. I also, like I'm very much about if I'm not doing it, I'm not going to expect others to do, it's I'm definitely in that aspect. The other aspect of just realize kind of meeting where they are. Like right now it's a very difficult time and I call them small wins. Like if
Mm,
you like you're saying for one of them to lose weight, what's part of that, like the connection that they're losing, the
mm,
mental health aspects that have gone on, and it's even if they can just do one part, it's like, all right,
mm,
drink a little bit more water for me today.
mm,
I'm excited, and the fact that, we just are emotionally, right now has been very emotional and people have been, you know, you try to bring as much positivity through all of this
mm.
negativity, right? It's
Yeah.
difficult. I will say it
Yeah.
has been challenging. But with just in your bright colored shirt that you're wearing, the nice magenta color, that in itself can even make a difference, right? And just smiling. I just very much so, Dr. Vani, you being on the podcast today, and is there anything else that you're doing in your work or anything that's upcoming that you'd like to share today? I'd love to make sure the listeners can find you and reach out to you. And I'll have all of that available in the show notes.
Yeah, there's a chapter which has been finalized in the Rakel's Integrative Medicine book, which is getting an update. I think it's the fifth edition. So that I
Oh,
just
that's
signed the
exciting.
publisher's
Oh, and
agreement, so that should be coming out pretty soon. And there's several others small things happening, but I can't share them yet.
no, no, no worries.
But
When
this
that
is a
comes
major
up,
one where I actually signed the publisher agreement, so I can say,
oh no,
okay,
no.
it is happening.
Oh, no problem. I'll just, I'll put in ways for them to connect with you, and whenever, is available, you let us know. And I just very much so appreciate being on the show. And is there anything more that anything additional you want to talk about today before we end the show?
Yeah, I think, again, as you were just saying, trying to be positive, find a little spark, find a little light uh, wherever we are. At every moment, we need to find that little something positive. Otherwise, it is very hard. Life is hard now. I'm sure you know what's happening in India. It is
Oh
really,
yeah.
really, really, really tough. So we cannot be complacent, but we don't have to be all the time up in the arms and trying to do stuff. We can practice some self love, self care at every moment, so that we can give to others. Because if we only if we take care of ourselves, that we can give to others. So yes, let's take care of ourselves.
Oh my God. Thank you for sharing that extra. I completely agree with you. A little bit of self-love, you can embrace a lot. But thank you so much, Dr. Vani, for being on the show. And I look forward to you being on again. Maybe we'll talk further in other discussions. So thanks so
Yes.
much. And you have
Thank
a
you very much
wonderful
too,
day.
and I'd love to be again with you. It's been a wonderful
Yeah,
conversation
and
here.
we'll go into more detail.
More
Have a
detail.
great day.
Yeah.
Bye.
Have a good day. Bye bye.